If the cancer is contained within the prostate and hasn't spread, then you have a number of treatment options open to you. In order to help determine which treatment is best for you, I look at a number of factors, including how aggressive the cancer is, what is its Gleason grade, how does the prostate feel, what's your prostate size like, whether you have any waterworks issues, what is your age, what's your sexual function like, and also what your general health is like.
One option is to simply monitor the cancer, which is known as active surveillance.
Active surveillance, in essence, is where a patient has low-grade, low-volume disease that we think may not necessarily cause them a problem. And in these instances, we can monitor the cancer and then intervene if it looks like it's progressing. We do not have established long-term data for active surveillance, but the data that we do have suggests that it is quite good in the appropriately selected individual. The advantages of active surveillance are that it avoids over-treatment of potentially insignificant disease. The disadvantages, though, is that we are relying on PSA estimates and prostate biopsy to accurately tell us how much cancer is there. And both of those things are not necessarily that accurate and may underestimate the degree of cancer that a man has.
One of the more common forms of treatment is surgery to remove the prostate and any cancer contained within it.
By taking the prostate gland out, we're able to accurately analyse it under the microscope, and so we can see exactly what cancer is there and how much it is there. It also physically removes the prostate and the cancer from a man's body. In addition, we have the option of radiotherapy as a backup if needed. The disadvantages, though, is that it is a big operation.
Possible risks include hemorrhage, blood transfusion, infection, injury to nearby organs such as the rectum, incontinence and impotence.
Certainly, surgery will interfere with the strength of a man's erections, but we are able to, wherever possible, give them their best chance of getting their erections back. Nerve-sparing surgery is where we preserve the nerves to the penis and therefore aim to preserve a man's sexual function. If the cancer, however, is aggressive and may be involving those nerves, then it may not be possible to spare those nerves. If I'm able to leave both of those nerves behind, then the chances are quite good that a man who has normal erections from the outset will get their erections back, but it may take 1 or 2 years for those erections to return. If the erections do not come back, then a man can still get erections. It's just a matter of how. When we're talking about getting the erections back, we mean either spontaneously or with the assistance of a tablet. However, if that's not working, then men can use injectable therapy, which works very well and can work quite well for a number of years. And then beyond that, we can look at the option of a penile prosthesis, which is a penile implant to help get erections.
Removing the prostate will render a man sterile. Men who still want to have children can store their sperm at a sperm bank.
In that way, they have sperm available so that then they and their partner can undertake a variety of the assisted reproductive techniques that are available.
Most men will experience some incontinence after surgery.
All men should expect to wear pads after surgery. After a week, around 1 in 4 men will have gotten rid of their pads. This gradually improves over time. At about a year, 1 in 10 men will still need to wear some pads. Very occasionally, some men will need further surgery to correct any ongoing incontinence. There are 3 options for surgery: open surgery, laparoscopic surgery, and robotic surgery. Open surgery is where the surgeon makes an incision into the patient's abdomen and uses his hands to do the operation and to take the prostate out. Laparoscopic surgery is keyhole surgery using standard laparoscopic instruments. Robotic surgery is a form of laparoscopic surgery that makes laparoscopic surgery easier to perform with the assistance of a robotic interface. Now, largely, The outcomes of all three of these areas are broadly similar. Laparoscopic surgery and robotic surgery, though, are keyhole options, and as such, they offer less blood loss, less risk of blood transfusion, and generally a shorter hospital stay and potentially a more rapid recovery. There is no doubt that the robotic platform is amazing technology, and it certainly does make keyhole surgery a lot easier to perform. In my experience, patients do seem to get their continence back earlier after robotic surgery than with laparoscopy. In general terms, recovery is in the order of about 6 weeks. Some men may find it a little quicker, some men may find it a little slower.
Surgery is not suitable for every man with prostate cancer. In some cases, radiotherapy may be preferred.
What this does is it preferentially kills prostate cancer cells. The radiation, in essence, disrupts the DNA within the cancer cell so that the cell then dies. Some of the cells do not die straight away, but they are irreversibly damaged and then die at a later date. Now, of course, it will affect normal body tissue as well, and that's why some of the side effects occur, but normal body tissue cells are better able to repair and recover from that damage than the cancer cells are. The advantages of radiotherapy is that it avoids the various issues that can be associated with surgery. The other advantage is that it can potentially treat a broader area beyond the prostate. The disadvantages of radiotherapy are that it is daily treatment, once a day, 5 days a week, really for 8 to 8.5 weeks. In addition, it is often combined with hormonal therapy for up to 18 months, which has its associated side effects which largely mimic menopause. Radiotherapy also brings in its own set of side effects. The other disadvantage of radiotherapy is that if the cancer does not respond to radiotherapy, then backup options are somewhat limited. In particular, it is extremely difficult to perform surgery after radiotherapy has been given. Men will get urinary irritation following radiotherapy, but this tends to settle down about 6 weeks after the radiotherapy is finished. In terms of bowel side effects, about 25% of men will get some irritation. Erectile dysfunction can also occur with radiotherapy. This is not so prevalent initially, but it does decrease over time, so that around about 50% of men have erectile difficulties at 5 years after radiotherapy for the average 60-year-old.
For more aggressive cancer, extra radiation may be needed in the form of high-dose rate brachytherapy.
HDR brachytherapy is where we aim to give an additional boost of radiation directly into the prostate. What this essentially involves is inserting needles directly into the prostate gland. Those needles stay in for a day and a half typically, and we are able to deliver radiation straight down those needles directly into the prostate. This is usually followed by a further 5 weeks of external radiation.
In some men, radioactive seed implants can be inserted into the prostate instead of using external beam radiation. This is known as low-dose rate brachytherapy.
Low-dose rate brachytherapy is where we put radioactive iodine seed implants into the prostate, and we use radiation to destroy the prostate cancer cells. The advantages of low-dose rate brachytherapy is that it avoids some of the issues associated with surgery and yet does not take 8 weeks of treatment like external beam radiation does. The disadvantages, though, is that it's not suitable for every patient. It is limited generally to patients with a Gleason score of 7 or less, a PSA of 10 or less, and a prostate examination that suggests the cancer is confined to the prostate. It is also not suitable necessarily in men who have a large prostate or who have significant urinary symptoms. We have good long-term data that low-dose rate brachytherapy is very effective, although most of that data tends to be in older men, particularly those over 60. I hope that you have found the information in these videos useful. This journey can be a daunting one, but it is important to remember that prostate cancer is treatable.
The information provided in this video is to assist patients and their families to understand the nature of prostate cancer and various options for treatment. The information is of a general nature only. It is important before entering into any treatment to ensure that you have discussed your specific situation, pathology results, clinical presentation, and options for treatment, as well as the pros and cons of the different treatment options with a urologist. This video is not a substitute for such a discussion, and whilst it will help you to understand the condition and the options for treatment, it should not be used as the only or even primary basis for making decisions about treatment. The views expressed by Dr. Gianduzo in the video are his own opinions based on the relevant literature and his experience. Other specialists may offer slightly different opinions. You should always consider seeking a second opinion if unsure about a treatment option.